Now, to discuss the healthcare crisis in Gaza, I'm joined by the spokesperson for the World Health Organization, Dr. Margaret Harris, and she's speaking to us from Geneva in Switzerland. Doctor, it's really good to speak to you on this news hour. The last time you spoke to TRT World was back in October, and you said, I'm quoting here, hospitals must never be a target. Hospitals are sanctuary places where people go to get care. They do not go there to get attacked. But what we've seen over the last week or so in northern Gaza is totally the opposite of this. And your group has been exceptionally outspoken about the continued attacks on healthcare facilities in Gaza.
Indeed. And in that time, international humanitarian law has not changed, not one jot. It remains very, very clear that hospitals, health workers, patients are off limits. They deserve protection because what they provide is something critical for the functioning of society, for societies everywhere. And even if there's a conflict going on and one side suspects, the other side suspects that there's military use, which also under international humanitarian law is forbidden. You cannot use hospitals for military use. But even if one side suspects the other is doing that, the bar is still very high. They must ensure that every patient, every health worker and the hospital itself is protected. They can't just go in and destroy it the way we are seeing this actually happening.
Fair then to say that it does seem that international law is being broken on a daily basis in Gaza. But for the people there, especially those now in the north in need of medical attention, what does this mean for them? Because if Kamal Adwan is shuttered, there is very limited healthcare in that region.
I would say there's yes, it's the end. It's the decimation, the destruction of healthcare, and we really have seen a systematic dismantling of healthcare in the north particularly, but now we're seeing further attacks in central Gaza. But indeed, there is very little option for anyone needing healthcare in northern Gaza at the moment. And we sent a mission up to the Indonesian hospital, which is also not functioning. It's just a building, just a shell. And we went up there to look at what was needed and found that everything is needed. There is no medical supplies, there's nothing. We brought up food, we brought up supplies, and we tried to bring 10 patients back. 4 of those patients were detained at the IDF checkpoint and taken away. One of them had spinal injuries.
How then do medical workers, and I mean this is across the board, from paramedics to doctors to nurses, how do they do their job? Because even before this war started, Gaza had several problems with regards to medical facilities, and doctors were doing an incredible job taking care of people there. But this, of course, has compounded those issues, especially now that aid is not getting into so many parts of the region. How are they actually coping?
You're absolutely right, Teresa. I am in awe of the medical staff and the nursing staff and the paramedical staff in Gaza, because despite what they're going through, and I remember hearing from a doctor a few months ago who said she had to pack up everything she had in her clinic and move whenever an evacuation order came in, and she'd had to do it several times and then just try to find somewhere to set up a clinic, knowing that there were hundreds of people who needed her help. And this is happening all over the Strip, despite the enormous risks to themselves and also the discomfort. You know, you're packing up your family, you're packing up everything else, but your first thought is for your patients. These healthcare workers are still continuing to do what they can, but it becomes harder and harder because they lack the supplies, they lack the place to do it. They lack the fuel, the electricity to make the machines work. And of course, they lack the safety.
And of course, they are working while also living in a war zone and going through it on a personal level, as you point out. Doctor, I'd like to look at these incredibly disturbing reports we've had of newborn babies dying over the last few days due to extreme cold. It is so difficult to imagine that happening in 2024 as we go into 2025, that this is an issue. And with those temperatures set to drop in the coming weeks, will we see more of this happening, not just among newborn babies, but also those who are extremely vulnerable, children and the elderly?
Unless we have a ceasefire, yes. Because indeed, cold is something that shuts your body down. But you're more likely to shut down if you've got no kind of reserves. You've got no fat, you've got no protein to heat your body internally because you are starving. And if you've also got diarrhea or another infectious disease, and those diseases are rampant among all the groups who are now displaced. I mean, 90% of the population is living under some kind of tent if they're lucky. Many of them don't even have a tent. And this time last year, a lot of the population was displaced, but they were in some kind of building. But the buildings have all been destroyed. So unless we get a ceasefire, it's a moral imperative. I don't care what the politics are. This is a stain on humanity. We are watching, parents are being forced to watch their children freeze to death. And we as the world should not allow this to happen.
Dr. Margaret Harris, I really appreciate you speaking to us from the World Health Organization. Thank you very much.
Thank you very much for having me.